causing water to flow through these covers.
Enkuba bulwetonya mukokoli tebakyagogola myala egyo mukokoli aleta force kati waleta force nga talinange gyakola kijasobola kuyitamu wansi n'asitula pavement ezo nezisituka mu bbanga.
It's not necessarily true that it's because our drainage channels are clogged and therefore the water hits up these manhole covers, sending them onto the roads and throwing them into other places. I mean, how come we find that the metallic ones are more vandalized than the plastic ones? Would you want to?
Several instances of resourceful community initiatives have emerged, such as a shop near Eso Corner covering an open manhole with wooden material, along with a cautionary sign commended by KCCA.
Someone is improvising. We cannot then go ahead and say, because some people, there is a metallic manhole cover. The authority has not replaced it because of constraints in resources. But the business owner neighboring that gaping manhole chooses to cover it with a slab of wood. Would you honestly want to castigate this person that has gone beyond their call of duty to try and improvise and create safety for himself and their customers?
At the Kampala Yard roundabout, there are 2 open manholes, one of which was damaged by a police tear gas truck and another was stolen for scrap. While KCCA may lack the necessary resources to replace all drainage manholes, it has issued strict orders to private service providers, mandating the continuous coverage of their ducts.
Regular inspection of the state of these manhole covers, and resources allowing, we always replace them. Where they are not replaced, it's not because we are not aware, but for the most part we do not have the resources to immediately replace. And that's why sometimes we circle out the area with the duct tape to indicate that this is an area that is a no-go zone, and sometimes we also use the rudimentary element of putting a tree branch in there so that we warn pedestrians, motorists and others of the looming danger of an open gap.
In some areas, like near Diamond Trust Bank on Kampala Road, intact ducts can be observed, allowing people to move confidently over them. I'm Nafka Farida and Sana Anet in Kampala.
Thank you so much, Farida and Sana. Uganda should endeavour to ensure that her health sector is heavily funded by public funds as a prerequisite to achieving the universal health coverage, thereby promoting equity and equality in health service delivery. In a statement read for him at the 5th Annual National Health Financing Conference, the World Health Organization Country Director, Dr. Yona, said that a country that envisages sustainable health service delivery for her nationals has no option but to foster domestic finances. Take a look.
Uganda continues to perform below average as regards to health sector financing, which currently stands at about 9.6% despite an upward trend in budgetary allocation over the years. This is way below the Abuja Declaration that calls for 15% of government's total expenditure. Speaking on behalf of the World Health Organization Country Director at the 5th Annual National Health Financing Conference, Dr. Sani Okorafo underscored the need for Uganda to pull up her socks through domestic financing.
Beyond relying on an increasing public funds, countries should ensure that the funds are predictable and that they are stable. Now, these 2 key attributes are important because they enable us for greater efficiency on how the revenues are used and accounted for.
This call comes amidst reports that external financing for the health sector is dwindling, which status ultimately negatively impacts service delivery to the vulnerable poor.
According to our national health accounts for 2022-2023, we see that the total health expenditure is very high, and the levels of poverty is also very high, and the situation becomes very worse to some of us. I've already told you, I'm a survivor of cervical cancer, a woman living with HIV, a woman providing palliative care to my mom who was hit by stroke. So I actually have the real lived experience when you talk of out of pocket.
Government has made major strides in ensuring adequate funding for the health sector, but let down by leakages of resources allocated occasioned by poor monitoring.
Some of these PPDA, construction of health centers. Just look at, for example, a maternity ward costing over 700 million. Do you know if that money is given to me, even 150 to 200 million can't do that structure? So there is a lot of extravagance.
As a country, we have spent a lot of money on investment in capital expenditure, building new health facilities, building new theaters and all that. What is key now at the point at which we are is to ensure that those facilities are functionalized, ensuring that they have medicines, they have blood, they have staffing in these health facilities, so that we enable those who are farthest behind in our community, the weakest, the poorest in our communities, to be able to get service delivery in public health delivery systems.
By and large, processing the National Health Insurance Scheme would seal the deal, as Joel Sebikari, the Ntwetwe County Member of Parliament, explains.
Once national health insurance is established in this country, is where government, is where executive can commit itself to the real funding of 15%. More funding will come in to fund medicines, to fund health workers recruitment, to fund community health workers, to fund infrastructure for the health sector, to fund the referral system, to educate the masses, but more the preventive part of it is what I'm talking about.
This year's National Health Financing Conference is running under the theme Deepening and Exploring Innovative Approaches to Domestic Health Financing in Uganda. Dorcas Kimono, UBC News.
In response to the shortage of ophthalmologists in the Mpigi district, which has led to a high prevalence of eye-related diseases among both children and adults, Babies Uganda and Civic School for the Blind Children and Mengo Eyes Hospital joined hands to organize a free eye treatment camp in Bwama. Headmistress of Civic School for the Blind, Teddy Namakula, expressed her relief at the initiative, emphasizing its importance for communities lacking the resources to access eye-related services. An ophthalmic clinician, from Mengo Eyes Hospital, Dr. David Nsamba, highlighted the widespread issue of eye diseases among children and adults, underlining the urgent need for attention.
The limited number of eye specialists in both private and public health facilities in Mpigi district has led to the rise of complicated eye-related diseases among residents. Research conducted by the Center for Vision and Impaired Children revealed that out of the 4,000 annual eye surgical procedures, 50% of them are related to cataracts.
In Mpigi district, we lack hospitals with specialists in eyes, like ophthalmologists. It becomes very expensive for someone to leave Mpigi to go to Kampala and then look for specialists and also pay highly. But if the service was within, it would be easier for everyone to come, and maybe some of the children we have here would not even be blind, but because they've delayed to see the doctor, they have been diagnosed to be permanently blind.
With courtesy support of Babies Uganda, Civic School for the Blind, in collaboration with Mengo Eyes Hospital and partners, organized an eye treatment camp in Bwama, Mpigi district. The camp aimed to provide free and affordable eye services to communities affected by eye-related diseases.
The people who have come have issues with their sight, which issues can be addressed by doctors. Africans have a tendency of not visiting doctors regularly, yet at times what may be wrong with their health may be something easy, something which can help them to prevent major diseases.
An ophthalmic clinic at Mengo Eyes Hospital, Dr. David Nsamba, emphasized the need to regulate the use of technological gadgets such as smartphones, tablets and computers to reduce the increasing cases of eye diseases among children.
So here we have the children who are blind, we are screening them and we are getting out those ones that can be picked from blindness into this category where people can be able to see well. Then the population, the community, well, so far I've seen some patients with cataracts, some with glaucoma, and others with allergens.
The coordinator of Babies Uganda, Maria Galan, noted that shortage of resources is contributing to complicated eye diseases.
Sometimes the problem is that because of no resources, people is not going to hospital early. Now, many cases that can be treated if you detected them in the past would be okay now. But now it's too late, maybe need to do an operation because the eye is already in a very bad situation. So I think it's good to educate people that they need to be checking and to avoid other problems that can be worse.
Services offered at the eye treatment camp included free checkups, advice and subsidized treatments, drugs and surgeries. Sudat Kaye and Robert Bwaita, UBC News.
Thank you so much, Sudat Kaye and Bwaita. The term onward movers has emerged to describe refugees who seek better opportunities by relocating from one country to another. More than 1,000 individuals returned to refugee settlements in Uganda seeking refuge once again. They had initially left these settlements in search of a better life but found their lives unbearable in the refugee camps of Kakuma and central Kenya. The government has also responded to this situation by tasking the National Agricultural Organization NARO with introducing nutritious and fast-growing crops to alleviate food shortages within refugee communities.
We are receiving majority, I should say 98% of the people received are coming from Democratic Republic of Congo.
Uganda currently hosts a refugee population of over 1.53 million individuals and asylum seekers. These refugees are accommodated in settlements across the southwestern, West Nile and northwestern districts of the country. They reside on government-owned land and receive support from both the government and various partners. Unfortunately, the availability of financial resources has dwindled due to the impacts of the COVID-19 pandemic, the war in Ukraine, and the global economic downturn.
We are having increasing numbers of refugees day in, day out, but each year we are having resources decrease. I think this is going to be very challenging for government, first of all, to support the refugee operation in the region because it suppresses economically the different host districts in the different sectors. You see a lot of crowding in schools, a lot of crowding in health centers or hospitals. Of course, the road network within the refugee settlements, the districts is being affected. But all of this can be handled and managed well for refugees and nationals within those areas to get better services if resources are available.
Consequently, there have been reductions in food rations and financial support to refugees, which prompted some of them to leave Uganda for Kenya, attracted by promises of a better life.
And what could have caused those movements, to me, I think, from the interaction I've had with refugees,